Thanks, Nicole. Good afternoon, everyone, and thanks for joining me here today. Premiers from across Canada will meet with the Prime Minister Justin Trudeau tomorrow to discuss Canada's healthcare system and what needs to happen in order for the healthcare needs of our residents to be met. The Northwest Territories is unique, and we have specific challenges that residents require to be met. Since before the pandemic, premiers have been asking for an increase to the Canada Health Transfer. This call has only become louder and more persistent as the pandemic has wreaked havoc on healthcare across the country. This per capita payment is an important piece of what pays for healthcare in the Northwest Territories. However, it does not do enough to address the extraordinary costs we are dealing with. As a small jurisdiction, per capita payments, as you know, don't benefit us as much as the more populated provinces. Health outcomes among Indigenous people, which make up more than 50% of the Northwest Territories, remain significantly troublesome compared to the better outcomes experienced by non-Indigenous residents. Our challenges are significant. We have a small population spread across 33 communities, many of which are some of the most remote in Canada. We struggle to achieve economies of scale. We feel that the impacts and legacy of colonization and residential schools regularly. All of these factors contribute to the reality that per person, we spend 4 times the national average on healthcare in the Northwest Territories. In a time when society and governments across the country are focused on helping the most vulnerable to ensure they have the supports and programs they need, we continue to deal with significant and unfair gaps. We need Canada. We need Canada to provide more healthcare funding so we can provide the health and mental health supports and services for residents of the Northwest Territories that they need, that they deserve. I'm encouraged that Canada is looking at both a Canada Health Transfer increase and bilateral agreements that can be focused on areas of highest priority within each jurisdiction. Canada has identified priority areas for bilateral agreements. The areas are the primary health, mental health, long-term care, virtual care, and data collection. But we have also indicated that we need to be flexible to meet our own priorities. I don't have any more details on exactly what will be discussed tomorrow, but I do look forward to meeting with the Prime Minister and all premiers tomorrow to find a path forward on healthcare that is sustainable to our system. And that, I'm going to turn it back to Nicole to moderate the question and answer period of this media availability. And again, thank you for being here.
Thank you, Premier. We will now move on to the question period. As I mentioned earlier, each news outlet will have the opportunity to ask a question and a follow-up. If we have time to go through the list a second time and give every news outlet an additional question, we will do that. Again, I remind you to please mute your mics until you are called upon, and please mute yourself again after you have asked your question. So the order was posted in the chat, and it will be as follows. We will start with CPAC and then move on to CBC, then Cabin Radio, and then Média Ténois. Am I missing anyone? Okay, I will take that as a no. So we will start off with CPAC. Richard, are you ready? Richard, I'm not hearing you.
Oh.
Hello.
Hello.
Hello, Richard.
We're just standing by for the meeting. No, sorry, my mistake.
Do you have a question, Richard?
No, I do not.
Okay, thank you. We'll move on to CBC. Megan?
Hello, can you hear me all right? Awesome. I'm wondering, you mentioned the priority areas, that Canada had outlined for its bilateral agreement. I'm wondering if you can elaborate, Premier, on what on the NWT priorities that you will be pushing in the meeting tomorrow.
Well, the Northwest Territories, like I said, is unique. We have 33 communities spread over a vast area of land. Many are inaccessible except by plane or winter roads. Our healthcare system is not as comprehensive in the south. In fact, we use Alberta a lot for a lot of our services. So our costs are higher. And that's the biggest thing I need to emphasize to the federal government is that you can't fund us per capita. It doesn't work for us. It doesn't work in any of the programs that we get funded for. I think the other really priority for me is we have the Council of Leaders table. And when it comes to healthcare, mental health and addictions was the #1 priority identified by all leaders around the table. So respecting the leaders of the Northwest Territories, mental health and addictions needs to be a priority for the Northwest Territories going forward.
Oh, awesome. Can I ask a second question?
Yes, go ahead.
Awesome. Yeah, I'm wondering as well, given that the entire country is competing for healthcare staff right now, how are you going to ensure that the NWT, as a smaller jurisdiction, like you mentioned, is included in those conversations and ensuring that we get the necessary staff as well?
Well, there's two things. I mean, of course, we need more financial funding for recruitment and retention, but there's more that we have to do. We're competing with the larger jurisdictions, and so we have to really focus on what the beauty of the North, why would people want to move there? What do we have to offer to people in the healthcare profession that would bring them to the Northwest Territories? So one part is the funding that we're seeking. The other part is really emphasizing the benefits of working in the Northwest Territories. Thank you.
Thank you, Megan. We'll now move on to Cabin Radio and Brooklyn Conley.
I have no questions at this time. Thank you.
Okay, thank you. Media Tinois, Raphael.
Yeah, I'm good also. Thank you.
Okay, thank you. Okay, with that, Megan, did you have any other questions since we're going to our second round?
I did actually.
Okay.
Awesome. I'm just wondering, you mentioned, of course, that mental health and addictions are a priority for many of the leaders in the NWT. If the NWT is able to obtain more healthcare funding through this agreement, would the Northwest Territories government consider building a residential treatment facility for the territory?
Thanks, Megan. I do think that, again, this issue has been brought up to the Indigenous governments through our council leader. Minister Green has had initial meetings with them. Once we discuss the bilaterals and we find out what exactly we're looking at, how much funding we're getting, etc., then I think that needs to go back to the council leaders table to address how we work together. Mental health and addictions isn't something that the GNWT can address alone. We need to work with the Indigenous governments on this. The majority of Indigenous people are affected by it. And so because of colonization and residential school, so we need to have those discussions at the larger table and to decide how we utilize our resources and the supports we provide for people. So, thank you.
Thank you, Premier. Did you want to ask one more follow-up question, Megan, or was that everything?
Those are all the questions I have at this time. Thanks so much.
Okay, thank you. This concludes our briefing. Thank you to the Premier for joining us today, and thank you to all of the members of the media for being here as well. If you have any further questions, please reach out to the Office of the Press Secretary at presssecretary@gov.nt.ca. Thank you and have a great afternoon.
Thank you, everyone.